We're seeing a significant uptake in coronavirus here in our region. I worked yesterday in the emergency department, and we had 12 people that were COVID positive. A significant portion of those had already been vaccinated, but none of those vaccinated patients, and some of them were quite elderly, were admitted to the hospital. So I guess what I'm saying is that we're seeing breakthroughs, but in my professional opinion, there seems to be some reduction in the severity of illness. I did have to admit people yesterday with coronavirus, and none of those were vaccinated. So far today, I already have 3 on the board that are COVID positive, and those 3 patients will all be admitted to the hospital, and none of those 3 patients were vaccinated. So I know there's a lot of political issues around vaccination, not getting vaccinated. I would just tell you that my observation are that it does help, at least prevent the severity of illness. I do believe that it does help with you contracting coronavirus, and I would encourage you all to please do so. I want to talk a little bit about masking again. I think those of us who have been vaccinated have had this sense of security that we're vaccinated now, and CDC says that we don't have to, and then the next week they say we have. All I will tell you is I have not seen one influenza all during the flu season. So I think hand washing and wearing masks certainly does help with the spread of viruses, whether it's COVID or whether it's influenza. So I would ask you to strongly consider that, particularly if you're immunocompromised, have cancer, lung problems, etc. And even again, if you've been vaccinated or not. Lastly, I will tell you that your healthcare providers are tired. We've just spent 18 months fighting this. We all kind of had this breather that, oh, we're getting vaccinated and the numbers are dropping down. Clearly they're going back up here, and so I would ask you to please reach out to your healthcare workers, particularly those frontline workers, the nursing staff that are in the rooms day in and day out with these folks, and show them support, because the system is stressed. Nationally, there's a huge shortage of nurses because of people have just left the vocation because they're tired, and they are tired of being the risk of their lives, etc. So we are staffed fine here. Well, we can take care of our patients in the community, but I would just ask you to please reach out to them and give them some support if you have a chance to do so. I would really appreciate it. Wash your hands, wear a mask, get vaccinated, and we will do everything we can to take care of you here at the hospital.